up on your exam. Sorry, I was talking and I didn't realize that I had um not unmuted myself. All right, so you made it through exam one. Good job. Um, I still got some more coming back in. All right. So I believe our meeting is tomorrow morning. So you should have your results shortly after that. Um, and still, we have one student, bless her heart, that is having some issues getting her exam to upload. So, all right. So today, pull up my um I'm hoping everybody fared well throughout the storm. I know that everybody was hit pretty hard, or a lot of people were hit pretty hard, and then some people that were supposed to get hit didn't get hit as hard as they thought they were going to. So glad for that. Feel bad for others that got hit pretty hard, but um, so today we have um, we're going to talk about assertiveness and what do you call it? Communication. Sorry, my brain just was like not processing communication all of a sudden. Um, so again, welcome to week four. So we're going to do chapters 8 and 9 in your success book. And then chapter 14, I believe, is in your other textbook for the course. Does anybody have any questions for me right now? Everybody's good. All right. I can't believe it's week four already. This term is going by super, super fast. Has everybody been able to get in contact with their groups as far as getting everything set up for that, your group project at the end of the term? Okay. All right. So let's start with, again, we're going to start with chapter 8 in your success book. So it is about effective communication. So I'll share my screen so you guys can see the PowerPoint. All right. Oops. Everybody can see my screen. Awesome. All right. So communication. When we look at communication, we have one-way communication and we have two-way communication. One-way communication is used to give an exam, give a command, right? So I'm prior military, so we don't really, when you give a command, you just expect, oops, um, there's no expectation of feedback, right? Like, go clean the bathroom, go mop the floor, right? Go, turn and reposition your resident, right? So it's giving a command. Whereas two-way communication is the usual form of conversation, right? So you're talking with somebody, you're having a nice little conversation, right? There's two, one person says something, another person replies, um, and each person contributes equally. And so there are five essential components: the source or the sender, the message, the method of transmission, the receiver, and feedback. And so we have to have all five of those parts for effective communication. Um, so the source, like me talking to you, right, sending you the message. And then, you are the receiver. And so, like when I asked, how everybody is doing, right? So people, said fine, they fared the weather. Um, whatever that feedback is, that's a normal conversation. There's always going to be things that are going to affect communication. And so these are things like personal characteristics, both of the sender as well as the receiver. It could be age, it could be gender, it could be income, it could be life experiences, attitudes, personal opinions, biases, right? Those are all personal characteristics. Cultural characteristics, personal space, distance, language, dialect, the use and meaning of touch, your values, meaning of gestures, time of day. Those are all cultural characteristics. Your situational influences, right? This can include physical. So, like if somebody is in pain, their emotional state, so if they're anxious, upset, nervous, um, it could be the any odors, any distractions. It could be the room temperature. It could be privacy concerns, right? Environmental distractions as well. And then context. All right. So context could be the appropriateness or inappropriateness of the communication. It's the background, the circumstances that are leading to the conversation that we are having with somebody. And then we have types of communication. So we have verbal and we have nonverbal, right? So verbal, we know how powerful speech is or how powerful that spoken word is. And so we have to be careful with how we say things, right? And, how we speak to people, making sure that we are speaking as clearly as possible, that we're using proper grammar, generally speaking, right? Avoiding slang, because slang can have different meanings to different people. And so, depending on the age and the culture, the client may not understand slang. So I'm older, so some of the slang that, some of the younger generations use, I have no idea what they're saying, right? Not even gonna lie. And some of the words, I'm like, what is that even supposed to mean? Um, and so, I thank God for the internet sometimes because, sometimes you can look things up and be like, what does this even mean? Um, Medical jargon is very rarely appropriate. Yes, we spend all this time in nursing school, right, teaching you all these big, nice words that you can use. But it is very rarely helpful because most people aren't going to understand, what you're saying if you start using those big words. Um, and so, depending on what age of the client that you're dealing with, right, we may have to use more age appropriate terms or things that we know that they would understand. So, for example, with that, when I was a brand new LPN, I was working on a skilled care unit. Um, and I don't remember, I want to say the resident asked me for something. I know it was a drink, and I brought them back a drink, and she said, "No, honey, I can't have that. I have the sugar." And I had no idea what she was talking about. I had never heard that before. And so I, had to dig a little deeper, realizing that she was saying that she had diabetes. So we do kind of have to be careful with that. Um, and then we have some nonverbal communication. Just going to hold on for a second. Somebody is logged in as student. If you could please put your name in, not sure who it is, but I need cameras on, please. Um, and whoever is logged in as student, please change your name
I'm
or
trying
tell me who
to.
you are so I can fix it.
This is Tasha Griffin. I'm trying to.
I
This
can do it. Okay.
I don't know how to. It says this camera is disabled. I'm using someone's laptop because my laptop was having issues.
Okay.
So I'm
Here,
hearing you.
I'm gonna put your name on it. Is it Griffith or
No,
IN?
I-N.
IN, sorry,
I-N.
couldn't remember. Oh no.
Yes, that's it.
Okay. Oh no.
I'm listening to you, but I'm trying to figure out. It says some button is disabled from the camera.
Okay. All right. Well, you work on that. Um, so what are some, tell me about nonverbal communication. What is nonverbal communication? Give me some examples.
Like using your hands and body
body
language.
language.
Okay, using your hands, body language. I am a huge hand talker. Uh, my hands go, if I'm talking, my hands are moving. So I try to keep my camera pointed so that my hands don't distract anybody because they can even distract me sometimes. But it's even other things, right? It's how we position ourselves, right? So I won't, let me put my camera down a little bit. Don't mind the mannequin behind me, but if I sit here like this and I'm leaned back in my chair and I'm just talking, what does that show you?
You may not care.
That you not giving
I
me
don't
your
care. I may not
undivided
be interested,
attention.
right? In either you learning or, even information that I'm presenting to you, right? Um, So, we've got to be careful with, how we're presenting. This is a big one too, right? Our face, what our face shows to the people that we are talking to. So we have to be really careful with our nonverbal communication. It also nonverbal too. It's not only is it, how we appear to people, but it is also the volume and the tone of our voice that we're using when we're communicating, right? I can sit here and talk really monotone and not have any inflection in my voice, right? And probably put you guys to sleep really quick if I were to keep talking like that. Or on the opposite side of that, right? You're not going to listen to anything that I say. Um, and so we do have to be really careful when we are talking to people. If we're trying to show that we care, we're trying to show empathy, right? We have to make sure that our body language also, right, shows that. It's also how we dress and how we appear to people, right? Making sure that, we're clean, our uniforms aren't a wrinkled mess. We're trying to portray that wonderful, professional appearance. And it's also too how we see our clients, right? How they dress and how they appear also can give us some insight, right, into what is going on with them. Um, so again, the spoken word we know is very powerful. Once you say something, right, you can't take it back. Nonverbal communication is powerful and it can support or cancel the meaning of verbal communication, right? So just like when I had my arms crossed and I was leaning back, right? I can sit here like this and go, oh yeah, I care about y'all, right? I want to make sure that you get this information, right? Does that match? No, doesn't match, right? Or, you know, if I'm like this, oh yeah, I'm listening to you. Yeah. Uh-huh. Sure. Whatever. Right. It's the same type of situation, right? So we have to make sure that those match. And so we want to be sure we want to be sure that make sure that our verbal and our nonverbal match and that we're using all of our strategies to ensure minimal impact to our nonverbal behavior. So again, your face, how we how we look. Um, Affect is mood or emotion. Okay, and so that's um, the feeling tone that you pick up as you approach a person or step into a room. So, like, have you ever walked into a room and it feels really heavy and very tense, right? And you can feel that, right, when you walk into a room. And so every thought that we have is going to elicit some sort of a physiologic response in your body, whether you're happy, whether you're sad, whether you're upset or angry, okay? People can pick up on that, right? And so that's why, we have to be careful of our energy or our aura, right? When we walk into a room. Um, Oops. So our nonverbal behaviors. So think of, some of the things that, we do. Our arms folded, yawning is another one. Oh, if I'm yawning while I'm talking to you, right, that also shows could be your client is tired, right? But it also usually shows that someone is, disinterested in what you're having to say. Arms folded, not making eye contact. Now, I will say with not making eye contact, we do have to take into consideration culture, okay? Um, but generally speaking, not making eye contact isn't a good verbal and nonverbal behavior. Looking bored or distracted, our facial expressions, the volume and the tone of voice. Some cultures, though, I will say, some cultures are very loud and boisterous. Others may be a little bit more soft and reserved. So take that into consideration as well. But be careful how we go and talk to our clients. So, active listening is the most important part of our therapeutic communication. And that's the interaction that we have between us and our clients. It helps it's focusing on those clients' physical as well as their emotional needs. And so there are some key factors in active listening. And so these are the behaviors that we can use to show that we are listening to our clients, that what our clients say is important to us. So, some of these or some of the behaviors or some of the techniques. Restating is one. So restating, it refers to repeating what the client says in a slightly different way. So I think the example in your book says, what is it? My chest hurts. I can't sleep at night. All right. So restating would be you've been unable to sleep at night because your chest hurts. Okay, so that's just simply restating what they said, just slightly different. Clarifying is asking a closed-ended question in response to a client statement to make sure that you understand. So, client says, my chest hurts. So, okay, show me where your chest hurts, right? Or point to where your chest hurts, right? That's closed-ended. It's giving, it's just clarifying that information. Reflecting is putting into words the information you are receiving from the client at an effective communication level. And so the book example, give me a second because I know it. Um, the client says, I'm tired of seeing healthcare providers and not getting any answers. All right. So reflecting would be you're upset with the lack of information or lack of answers to your health problems. Okay, so that is just putting into words the information you receive. Paraphrasing is what we do when we write papers, right? This is expressing in your own words what you think the client means, right? So when you're reading a research article and you got to put it into a paper or a discussion question, right? You're going to read something and you're going to put that information in your own words. So if I say I'm not being told the truth about my condition, all right, something, paraphrasing would be, okay, you believe you haven't received all the information about your health condition, right? That's just paraphrasing. Minimally encouraging words, we've all used these. These are sounds or words that encourage the client to continue. right? And so you could be like, uh-huh, yes, go on, then what happened, right? It's just little words to help them to continue with the story. And then we have silence. And silence is something that can be very difficult for a lot of people. Okay. And this is just using pauses effectively. A lot of people are uncomfortable with silence and feel like they need to fill that, air with sound. Um, and so, think of, some times where silence has been really important, whether it's sitting with a client or a patient that is upset and just allowing them to feel your presence, to sit there with them. It also could be when you're working with older adults, right? Who, maybe have a little bit slower processing time, need a couple seconds just to gather their thoughts before they answer a question. It also could be when you're angry. Okay. Who's got kids? Raise your hand if you have kids. All right. Has anybody ever, you just stop, your kid does something and it upsets you and, rather than just, going with your gut instinct, you kind of stop for a second, right? Count to five before you respond. Okay, so silence can be a very effective strategy when we are, communicating with our clients. Summarizing is just stating the main idea that you have gathered, right? And this could be, you've gotten all the information, okay, and then you say, this is what I heard you say, and blah, 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 blah. And then, is that correct? Which leads us to the validating. And this allows the client to either correct any information once you have summarized it. So they can say, yes, that the information you said is correct, or it could say, no, you missed this part or you didn't understand this part. Let me, go back and say it again. All right. So that gives the client the time to either correct the information or say, yes, all is good. The types of questions, and we've all heard these before, your open-ended questions and your closed-ended questions. Open-ended questions, right, allow us or allow the client to respond in a way that is most meaningful, right? It's going to give you the most information, right? Um, the who, what, where, when, why of what's going on. Whereas our closed-ended questions, those usually require a specific answer, right? So, how are you feeling today? I'm fine. What is your pain on a scale of 0 to 10, right? Those kinds of questions. And then focus questions are more definitive information. So if your client says they have pain, then you can say, okay, show me where your pain is, right? So you can get more definitive information. Other ways to um, encourage positive communication, develop trust, right? Through honesty, openness, integrity, and dependability, right? So, when we're looking at building those relationships with our clients, these are things that we want to do, right? We want to be open. We want to be honest. Um, we want to be dependable, right? If you tell your client you'll be back in 5 minutes, make sure that you're back in 5 minutes. What are I messages? Has anybody heard this before? Has anybody heard I messages before? So iMessages are, how do I explain this? They allow us to or they allow people to respond without becoming defensive. Okay, so instead of saying you, um, let's see, I'm trying to think. You made me upset when you, I don't know, came late for class. Okay. So that, what does that do? That puts you automatically on the defensive, right? Like, well, you don't know what's going on, right? But if I said, um, I get, and I don't get mad, but, trying to think of a good word. I get upset when you're late for class because I worry about you, right? Especially with the weather. So how's that tone different?
It shows more of a caring, uh, like you care.
More like I care that I'm not putting you on the defensive, like, oh my God, I know I was late for class, but she just doesn't get it, right?
Yes.
Um, so yeah, so that's a difference. And so when we use iMessages, we kind of avoid people getting defensive with us, right? We're just kind of using, a different technique to avoid that from happening. And it also will encourage more positive communication. Let me get something quick. Okay. Okay. Sorry. All right. So, eye contact. We know eye contact is super important as well. Maintaining our eye contact, right? A lot of people, if you can't maintain eye contact, right, it's almost like a distrust. Positive thinking. Tell me about positive thinking. Is positive thinking like, oh, excuse me, everything is going to be okay? What's positive thinking? I know this is a hard one, right?
Is it like more like looking on a brighter side of things or kind of like encouraging
There you
someone?
go. It's encouraging. Yeah, it's trying to look like on the brighter side so that it's not telling them, oh, it's going to be okay, right? But instead, it's kind of looking at maybe their deeper self, right? And trying to encourage hope, right? Rather than, you know, oh, having everybody down in the dumps, right? Because we know positive attitudes can have a really good effect on our health. Expressing empathy. Hmm. What's the difference between empathy and sympathy?
Sympathy, you're just feeling sorry.
Right. Sympathy is feeling sorry for somebody. People really want you to feel sorry for them. Not generally, right? Empathy is just being able to understand and appreciate what somebody else is feeling, right? Even if you have been in, a very similar situation to your client or somebody else that you are working with, right? You can never truly understand what somebody is going through because everybody experiences things differently. Open communication talk it's really kind of all of what we're talking about is just being open and honest. Self-esteem. Self-esteem is earned, it is not learned, okay? No one can give it to you, nobody can take it away. All right, that is that, you receive credit for something that you did well. It also gives you permission to recognize that you have something very special to offer, whether it's in nursing, communication, whatever it is, okay? And so Be aware your self-esteem, a lot of times too, that is portrayed when we are communicating. You can tell when somebody doesn't maybe know what they're talking about, or, is not, very comfortable with the situation, right? Um, and then, of course, being aware of your body language and your posture is absolutely key when we're discussing or talking with our clients. Oops, sorry. Your negative communication or blocks to communication, these are things that we want to try to avoid. Why questions? Like these are great when we have toddlers or young kids, right? And they're always asking why. Why questions can put the client on the defensive, right? So, your client smokes and drinks. Well, why do you smoke? Why do you drink? Or why do you drink so much? Right? That can put somebody on the defensive. False reassurances, those are things like, oh, everything's going to be okay. You'll be fine. Don't worry about it. Right? We don't know that. We don't know that. Right? Um, so you can't guarantee that. So we want to be very careful. We don't want to use any false assurances. Probing is another one. This is pushing for information that is beyond what we need to know. Okay, this is more of give me the tea. I just want to get, um, we don't need, to go into a whole bunch of questions that we don't need the information for. That it's not going to be part of their plan of care. It's not essential to our assessment. Judging is limited value as well, right? And so, we're just making sure that, we're establishing that therapeutic communication. If your client smokes, does illicit drugs, whatever the behavior is, whatever the action is, um, we we can, establish that therapeutic relationship with our client. We're not supporting their behavior, we're just acknowledging the behavior. Okay. We don't judge our clients. Everybody has reasons for things that they do. All right. But we're just here to take care of them. Belittling, making fun of mimicking or making fun of a client. It also can, be like downplaying the symptoms, right? So I always think about this, like when my kids were little, like, oh, my stomach hurts. Your stomach is fine. Like you're gonna be fine. Can't be that bad because you're walking and talking, right? Um, so, we just want to avoid those types of comments, and then giving advice. And if it hasn't started for you now, it eventually will. As a nursing student or even as a nurse, people are going to know that you're a nurse, and they're going to, what would you do if in this situation? Okay. And don't do it. That is the best thing I can tell you is don't give advice. And so I've gotten to the point where, you know, um, of course my kids are a little bit different, but and I'm like, oh, maybe you should just go see a doctor, if, you're sick or whatever. But you take away the autonomy of your clients, right? So let's say, you just had a client that was diagnosed with something, and they're trying to make a decision about the plan of care, and they ask you, well, what would you do? Okay, no, you don't want to be in that situation. We've also I've listened, I've heard some things where nurses have given advice, and people have followed the advice. And I'm not saying at work, I'm saying like out in your lives. Um, and they have been sued because, they followed the nurse's advice rather than, going to the doctor and things like that. And it didn't turn out well. So just be careful. I just say don't give advice. Um, always just whatever they feel is good for them is what they need to do. And we also want to be careful and avoid using simple answers. Remember, Knowledge is power, education, communication is essential. Sometimes, if we give those simple answers, it can allow our clients to feel dismissed or misunderstood. So you want to always give as much information, avoid those simple answers. Give us lots of communication, lots of education. So we talk about role changes, you know, um, one of the things that, nobody wants to be in, not that I know of, but nobody really wants to be in the hospital. Nobody wants to go and be in a situation where they're vulnerable. But we do have to remember that, when we're caring for clients, they are in a dependent and vulnerable position. Um, and so the concerns that they have often go beyond just what they're feeling physically, right? Because if I have to go into the hospital, who's going to teach my classes? I can't work, bills to pay, right? All of those wonderful things. So it's not just what's physically wrong, right? There's those psychosocial factors that are a part of it as well. Um, so when we look at that, right, always introduce yourself, knock on the door. Hi, my name is Jennifer. I'm going to be your nurse today. Um, Making sure that my verbal, my nonverbal, my affect all match. Again, we want to avoid using that nursing jargon or that unfamiliar terminology. We want to try to use words that the client will understand. Um, there's also a fear of the unknown. You don't, you know, we may know what it is, right? Because we work in healthcare. But, tests, procedures, um, you know, um, even something from, just a simple glucose test, right? May cause some fear about what the unknown is. And think of, I don't know if anybody has ever spent any time in the hospital, but there's a lot going on. You can't get any sleep because they're constantly waking you up for vital signs, for blood work, for medication, right? So lots of different things going on, lots of moving parts, lots of noises, lots of people. They can be scared. So who is their support system? Us, right? The nurses. And then again, like I said, those personal factors. If I'm sick, right, it's not just always about me. It's, not going to be able to work. Who's going to take care of my dogs, right? Who's going to pay my bills, right? So there's a lot of things that go on. And so we have to take that into consideration when we're caring for our clients as well. Try to be as understanding as possible, try to be a support system, maybe even help them to find some additional support, whether it's out in the community, through their church, whatever it is. And then environmental factors, like I said, whether you're in the hospital or clinic, what doesn't, it's not your home, right? It is not your home, no matter what. There's no really set privacy. And like I said, people are always coming in and out of the room. There's noises. Um, they're coming in for medications, they're drawing blood, they're doing all sorts of things. And so, it can be very frustrating. Has anybody ever spent any time in the hospital? No. Yeah. It wasn't fun. I don't know, it wasn't fun for me. The longest I've spent in the hospital is 6 days, and I'm good without having to go back. And then of course, depending on what level of the hospital that you're in, right? The ICU is usually the busiest units, right? With the most lights and sounds. So, kind of helping them to adjust to that. When we look at communicating with instructors, with staff, we know that good communication is essential, right? And so, effective, courteous communication is important among instructors, staff, yourselves as students, and then, of course, even our clients. So, these are the components of that: respect, trust, honesty, empathy, sensitivity, humor, knowledge, patience, lots of patience, and commitment. One thing about humor. Now, humor, healthy humor, and can help to lighten up a situation. But we do have to be careful with the use of humor and how we use it, right? Because, it can be taken offensively in certain situations, right? So we do want to be careful about the use of humor, but it can be a very healthy part of, the care that we provide. Who has heard of SBAR before? I know I'm going kind of quick. SBAR. So SBAR is your situation background assessment and recommendation. All right. So this is communication that we can use when we're communicating with a provider or even when we're communicating with a change of shift report. So when we're communicating with a provider, all right, um, we want information that is brief and to the point. So your situation, this is who you are, where you're calling from, who you're calling about, and what the problem is. So, hi, I'm Jennifer. I'm calling from, whatever unit. I'm calling about Mr. Smith in room 2. All right. And oh my gosh, I don't know. He had a high potassium. All right. High potassium level came back. All right. So, background, then I'm going to give the admitting diagnosis, when they were admitted, what their current status is. So, there are any vital signs, their medications, um, any allergies, their IV fluids, their code status, that kind of information. So, again, situation, why I'm calling. Background is why they're there. And then assessment. What do you think is going on with, the patient based on the findings? Is it life threatening? So I call me because they have a high potassium. I guess it could be, depending on how high that potassium level is, it could be life threatening. Um, but, and then of course, recommendation. That is what you need from the healthcare provider, right? So this could be, do you want them to come see the patient? Do you need a medication? Trying to think, do we need to transfer them to a higher level of care, or do we need to have a consult with another member of the healthcare team, right? So if I have high potassium, I just need him to tell me what medication would I give for somebody that had high potassium. Your shift reports are going to be a little bit different, right? You don't have to call and introduce yourself and tell hey, I'm calling about Mrs. Smith in room 1. The shift report, the situation, this is where we're providing information from the nurse that is relieving us. All right. So it's, the background, the situation is their admission date, their chief complaint, and their diagnosis. Okay. So when were they admitted? Why were they admitted? What's their actual diagnosis? Then their background information, their medical history, allergies, their code status, pain management, lab results, diet, um, radiology reports, I'm trying to think of, do they have any IVs? How do they move around? That, just that background information on the client, your assessment, your vital signs, your pain assessment, their diagnostic test results, their fall risk, their medications. Are they a diabetic? Trying to think, do they need to be turned and repositioned? Right? What is going on with that client? And then recommendations, their goal of care, what needs to be done on the next shift, as well as, their education and their discharge needs. SBARs are a really good way to communicate. It does make sure that you get all the pertinent information prior to leaving, handing it over to the next shift. We look at lifespan communication. All right. We know infants don't communicate except, of course, by crying, cooing. Their body language can also help us, give us an indication in how they're feeling, right? They act out their feelings with their body language. Preschoolers, their communication's a little bit different. They are usually known for their tantrums, right? They learned some words, but when they get frustrated, right, they can't always put them together, and that's where they end up having their tantrums. I always think of this as we're not meeting their needs, and trying to figure out what their needs is, while they're um, is why they're having their tantrum. Um, your school age have even more words. They want to be part of their, discussions. They also can draw pictures to kind of show how they're feeling. Our adolescents, I don't know if anybody, I don't know if anybody has teenagers or works with teenagers, but these can either be the easiest or the most difficult patients to communicate with. It really just depends on the teenager. And so I've done peds as well. So it really just depends. You're going to establish a relationship just like you would with an adult client and try to encourage that communication. A lot of them don't usually have a problem talking with you, but they may not express all their feelings and their concerns. And so that's where you have to really dig deeper. Most of the communications that we've talked about has been geared towards adults. When we look at elderly and their communication with the elderly, there's some things that we need to take into consideration, like our hearing and vision deficits that can occur as we get older. Um, and so, communicating appropriately according to those deficits. Just because they're deaf doesn't mean you yell at them, right? Generally speaking, when hearing starts to decline, they hear better in those low pitched tones. So yelling at them isn't, just really yelling and talking really loud isn't going to help. Um, we really want to make sure that we assess their hearing, right? So that we can ensure when we give them information and we provide education to them that they can hear us and understand us. That's another key. And then we have documentation. So how many of y'all have practiced writing nursing notes in clinical? Anybody? Some of you have, most of you have. Okay. Um, So, charting, the electronic documentation is usually where everybody is going to do their documentation. I don't think anybody is on paper documentation anymore, unless, of course, the power or the internet goes down. But it will be part of the rest of your life as far as documentation goes. And of course, you always want to make sure that you're following your facility protocols, but generally speaking, it needs to be accurate and factual, timely, thorough, very concise, clear, brief, to the point, and never use assumptions. So be very careful with what you're writing. Once you write something in a chart, especially with electronic documentation, it's there forever. Even if you strike it through, it will stay there. All right. So, if you accidentally chart on Mr. Jones and Mrs. Smith's chart, and you strike it through, it will still stay there. So always be very careful. You don't want any assumptions, any biases, anything that comes through in your documentation. And then other types of communication, of course, your cell phones, your text messaging, your social media. So cell phones, we have to be very careful with our cell phones. Your facility is going to have policies regarding your cell phone use, but generally speaking, don't record, don't take pictures, don't post them on Facebook or Instagram or what's the other one, Snapchat. Is that what it is? Um, and I know that you guys have seen on the news where nurses have gotten fired for, sharing information that they should not have shared, or even making, TikToks about, even though they're not actually showing clients or making fun of clients. Be very careful. You also, my suggestion is you never use your personal cell phone to send or receive confidential information regarding your job or even your own clinicals, to tell you the truth. Um, I know, like where I work, we do have cell phones that are the units. Um, and so, we will communicate with providers. We generally don't use patients' names though. I'll send pictures of wounds or other things, but generally we'll find some other way to identify the client rather than using their name. Don't even really use their room numbers a lot. Um, but we have some different things that we can do to identify the clients. So be very careful with that. And like I said, social media. Please just be very careful with social media. NCSBN, state boards of nursing also have some guidelines regarding all of this as well. And then the last part of this chapter is your conflict resolution. So conflict can be related to stress, diversity, language, generation. It also can be personality. And so, we are going to work with a diverse group of people. And it's generally speaking, it's, not, I don't know what the word is all of a sudden. It's nobody gets along with everybody, right? No matter what. I mean, I'd love to say that everybody in healthcare is great and we all love each other and get along great, right? But we know that that's not true. Um, However, right, we learn to work with people because we have to maintain professionalism. So general conflict resolution, we accept conflict as a natural part of life, right? We accept that there's different points of views, needs, beliefs. Um, Temper your own attitude and behaviors, right? Be aware of your initial reaction, take a deep breath. Sometimes that's where that silence, right, can come in. Somebody says something to you, right? You may put you automatically on the offensive, right? But sometimes just taking a deep breath and holding it in, right? And just processing. That brings you to take time to think critically before reacting. Um, Treat conflict as an opportunity to voice your own opinion and listen to the other side of the story, right? Um, like I said, not everybody's going to agree. Everybody has different values, different thoughts, ideas. And so, again, take it as an opportunity. You're allowed to voice your opinion, right? Just be careful how you voice it. Choose your approach. All right. So a win-lose approach will only escalate the intensity of feelings involved, right? That I'm right and you're wrong, right? That's only going to escalate those feelings, right? So trying to use more of a win-win approach instead of that win-lose approach. And that's where your active listening comes into play, that kind of thing, creative thinking, and then listen and learn. Conflicts are often based on assumptions and lack of information, right? So if you did happen to be wrong, apologize, right? Find out how to correct your mistake to avoid that from happening in the future. Discover what is important. All right, the core issue. And this could be anywhere from my feelings are hurt, to my needs are not being met, right? So really getting to the core, what is the actual conflict that is happening? And then respect one another. Okay. We know, and I know that conflict can be very emotional, right? And so we always want to be respectful. We want to stay away from the name calling, the blaming. We want to use our I statements, right? Um, and then, kind of go from there. Try to keep your emotion under check, so that, it doesn't get to the point where, you're yelling and screaming and causing a scene. and find common ground to create the highest common denominator, right? And so, generally speaking, in healthcare, that's really easy because we're all there to take care of our clients, right? So, we all have that common ground to fall back on. And, I've said this, when I've done nursing orientations and things like that in the past, right? Nobody expects everybody to get along 24/7 and, join a circle and sing Kumbaya. However, right? Because we all work in healthcare, we do have to find some sort of a common ground to work on. And so always treat each other with respect, continue, to work as a team. Um, and just trying to do the best that you can because it's the clients that end up getting hurt in the end if we're not getting along and not caring for them. All right, so that brings us to um, this is brings us to chapter 9, which is assertiveness. Does anybody have any questions about communication? All right, cool. So, chapter 9, again, this is about assertiveness. So, I'll share my screen for you guys. Um, yes, thank you. All right. So, assertiveness. So, we have a couple of different behavior or communication styles, okay? We have non-assertive, which is your passive. We have aggressive, and then we have assertive. All right. So, non-assertive behavior is fear-based behavior that is emotionally dishonest. It is a self-defeating type of behavior. Your non-assertive nurses tend to look the other way. They avoid conflict. They take the easy way out. All right. They also don't express their feelings, their needs, their ideas. When their rights are either deliberately or accidentally infringed upon, right? So, not a good behavior to have. Basically the overall message is saying that I don't count. Okay, you're more important than I am. I don't count. Your aggressive behaviors, and I'm sure everybody knows an aggressive person, um, violates the rights of others. Okay, it's very outspoken behavior. It is an attack on a person rather than the behavior, so it's more anger based. And when we look at aggressive behaviors, these are, you can usually see it a lot with the body language. Oh, awesome. They're leaning forward, they may glare at you, they may have clenched fists, right? Um, Obviously, that isn't, give me one second, that isn't a good type of behavior style to have as well, especially when we're dealing with clients or even with each other. Which brings us to our assertive. Give me one second, just checking. Got it. All right. So assertive behavior is not aggressive. It is a positive way for you to express um yourself. It is another name for honesty. It's taking that positive stand, being confident in your statement. You're speaking openly, but you're not violating others' rights. Okay. So basically, you're sticking up for yourself. All right. And with assertiveness, it's not always what you say, but how you say it. All right. So standing straight and tall, facing the person, maintaining eye contact to who you're speaking with, making sure that you're speaking in a clear voice, that you're loud enough that people can hear you, but you're not yelling. All right. And you want to make sure that you speak with assurance and confidence. And so this is, telling, this is, showing that, I matter, I count. right? I'm important as well. We can work together as a team in order to get things done. Um, so assertiveness is if you are not assertive, all right, and not everybody is, this is the best type of communication style that we can use. And, even if and I don't know if anybody has ever been in this type of situation, but where you've ever been openly criticized, about something in front of other people, right? How does that make you feel? Has anybody ever been like openly criticized in front of somebody? It makes you feel horrible, right? Like you're embarrassed, you may be angry, right? And so what do you do? We want to try to avoid that aggressive behavior, right? Because it's very easy to lash out. However, right, that's not the best way to handle a situation. Um, but you can still, approach it in a different way. You can try using the I statements, right? Like, I'm embarrassed, I'm angry, that you did that in front of, so and so. Um, stick up for yourself. It doesn't have to turn into a screaming match. Um, but stick up for yourself. It's even sometimes too, like when I don't know if anybody's experienced this either, but you're at work and somebody keeps giving you their work to do on top of it, right? That is not your job, right? So, how do we, stick up for yourself? Like, no, like, I have this to do, you need to do yours. So, it's just assertiveness is better. Negative interactions. So, again, we want to try to avoid negative interactions. But generally speaking, we have coping mechanisms. Everybody's got coping mechanisms that we use. So projection. Projection is a coping mechanism where individuals attribute their own weaknesses to others. Okay. And so, this could be like, I had a better education than you did, or the one that I hate the most. And I experienced this as both as an LPN as well. You're just a practical nurse, right? That's projection, right? I know LPNs that can run circles around some RNs, okay? Then that is a negative, that's an aggressive interaction. Rationalization, okay, is logical, but it's an untrue reason that's offered as an excuse for the behavior. And so, maybe that you're avoiding Mr. Jones because Mr. Jones is uncooperative with you and, he's just, a crotchety old man, okay? Um, and so you're using that as an excuse rather than trying to, hold on one second, rather than trying to really fix the situation. And then denial. Denial is the nurse can use this to excuse personal liability or personal responsibility. Like, it's not my job. I don't like that. Yeah. Um, I don't know what's going on here. Okay, hold on. So, refusing, to do something because it's not your responsibility. So we have problem solving steps, just like we have conflict resolution, we have problem solving steps. And so this is a series of steps that we use to solve problems. This was used prior to the nursing process. But the first step is to define the problem, right? What's the problem? And so sometimes you're going to have to really dig down, do a lot of investigation to really try to figure out what the issue is. The second step is deciding on a goal. So once you have a problem and you've written a problem statement, you want to decide on the goal and you want to apply the nursing process, right? So what do you want to do differently or what needs to be done differently? And so this could be a single goal or it could be multiple. And just like we write our goals for our patients, we write our goals for ourselves. And so you want to make sure that it's measurable, right? Attainable and time referenced. And you're choosing your alternatives. These are the interventions, right? So these are the things that you are going to cheat or to write to help you meet your goals. And then you're going to try them all out. All right. And then, evaluate the effectiveness of your approach, right? Just like we do with the nursing process. And just like the nursing process, if the solution isn't effective or we haven't reached the solution to the problem, then we go back to the beginning, right? We go back to decide on the goals, we choose our alternatives, and we just go through the problem solving steps until we reach an effective outcome. Um, and then our negative manipulative interactions, um, these feelings of, feelings and needs of others are disregarded, or people are treated as objects to fulfill the needs, right? So we try to avoid those behaviors. Anybody ever have to deal with with a manipulator? I'm gonna have to. Anybody ever had to deal with a manipulator or a manipulative person? They're not the easiest type of people to work with, right? They're going to try to manipulate you in order to get what they need, versus, what the good part of it for you is. The biggest thing with working with manipulative behaviors, I can't even get it out, is to, really set limits on their behaviors, and really call them out on their manipulative behaviors. If the situation doesn't resolve itself, all right, then a lot of times you may have to remove yourself from the situation. So it really depends, but manipulative people, and this, you can come into contact with manipulative patients, manipulative staff members, or people that you work with. But this is where your assertiveness, right, comes into play, that you're not going to deal with, you're not going to accept that type of behavior. And so you really have to set those limits. And if they violate those limits or they can't agree with those limits, then of course you're going to have to probably remove yourself from the situation, whether it's a coworker, or if it's a even a client, because we know clients even sometimes, with your what do you call it, your psych patients, right? Some of them can be extremely manipulative, and so we have to be really careful with those. All right. I'm sorry, I will share my screen again. All right. So I had to fix it because my email was blowing up for some reason. So aggressiveness and work-related issues. So unfortunately, this is part of society now, and I hate it. But, you know, unfortunately, workplace violence, is something that we potentially will have to face, at some point in our careers. And so assaults, um, comprise 10 to 11% of all workplace injuries, involving days away from work for healthcare workers. And so 54%, that's more than half nurses, experience verbal abuse by clients. 29% experience physical abuse from clients, which obviously that is, not acceptable, but OSHA, you've heard of OSHA, which is your Occupational Safety and Health Administration. They have guidelines to help prevent workplace violence. And so the level that your organization implements these things is, of course, going to depend on that because not all agencies are compliant with your OSHA guidelines. Um, so, but there are, it's training, it's, hazard prevention, it's, work site analysis, that kind of thing. So, what leads to workplace violence? And so many of these are going to be contributing factors, to all of nursing. So personal factors, the verbal, the nonverbal, and effective communication, right? Including the nurses' attitudes and behaviors, right? How we approach a client, do we approach them with respect and confidence, or are we already putting them on the defensive? Workplace practices. We need to make sure that practices are aimed at improving safety for healthcare workers. And so, this could be even down to, again, how you approach your clients, or how you appear to them. And then, of course, what happens when an incident occurs? How do we respond to it? Environmental factors is a really big one. In environmental factors, this is the type of client that is seen at the location. So, think about, in your areas, look at your different hospitals or different clinics, right? What clientele do they serve? Is it in a high crime area? Is it in a very like high drug area? That is all that's going to determine, right, the type of client that you are going to have admitted. And so things like, especially with hospitals and psychiatric facilities, right? Do they have guns, whether it's the client, whether it's the family, or even friends? Um, you know, um, and unfortunately, in today's society, right, we do have to look at that, even some of our psych patients as well. And then risk diagnosis. So the majority of all assaults are perpetrated by a small number of persons. So like especially if they've had like a history of violence behaviors. But we're working in the emergency room, we're not going to know if they have a history of violent behaviors, right? Unless, of course, they had been there before and they had done something. But things that we need to do and we need to understand: early signs, any unusual behavioral change, right? So something that, they were fine and all of a sudden now they started acting a little bit different. They're not cooperating, maybe cursing, other forms of hostile forms of communication. They anger easily, right? Frequent arguments. They're spreading rumors or gossip. Uninvited sexual remarks may also be part of this. Having hostile responses to other nurses, clients, even family members. Sleep disturbances, increased irritability, anxiety, and these could be even for fellow staff members, right? Because we know that violence isn't always going to come from clients. It could come from fellow staff as well. Um, then, some of these other behaviors like poor me, I'm the victim, notes with threats, violence, or sexual content, verbalization that includes plans or a desire to harm someone, stealing workplace property. So again, these can be either a coworker, or a client. Um, Less interest in work and workplace assignments, increased arguments, increased physical accidents or injuries, And then as the anger intensifies, um, it could lead to, depression, suicidal thoughts, even, other behaviors towards staff, fighting, destruction of property, that kind of thing. So how do we prevent workplace violence? So, you know, participate in training. So you want to make a personal commitment to follow prevention guidelines. Then, do trainings, do your refreshers that are offered by your healthcare agency. There are also sometimes with your police department or other outside agencies, there may be some other programs that you can take, like self-defense. Or even just understanding how to recognize threats, um, prepare for before workplace violence becomes an issue, be familiar with your workplace policies, also be alert to warning signs, and then take all threats seriously. And I think this is something that we all need to practice. Take all threats seriously, report them to management, and encourage others to do the same, because you just don't know. Something may, oh, I'm just kidding around, you don't really truly know if anybody is ever kidding around, right? So you want to be really careful. Um, and then advocate assertively for implementing prevention guidelines within the facility. So we are at our time. So there's like two more slides, so not too bad. But again, especially think about it when you are, when you're at work, especially night shifters, right? You always advocate for yourself. If you don't feel something is right, if security is not where it needs to be, then you need to advocate yourself for yourself, assertive, just for your protection. All right, with that being said, anybody have any questions? Oh, all right. So next week is week 5. So just you have your lesson activities for chapter 6 and chapter 7 for this week. That's the wrong chapter. Sorry, lesson activity in chapter 9 and then 8 and 9. And then next week we will continue with lecture. Your next unit exam is in week 6. So I will get the review schedule out to you guys shortly. But everybody have a safe week. Stay safe, stay warm, and I will see you next week. Tasha, don't go anywhere.